Everyone. It's another Wednesday with your fertility specialist. On behalf of Alps Hospitals, we love to say a very big thank you to our dear viewers. Thank you for liking our posts. Thank you for sharing. Thank you for always staying glued to your screen. I'm sure you're excited to be with us today, just the way we're excited to be with you guys this afternoon. I'm your host for this session today, Ruth Ugogo. And I have an amazing guest, which a lot of us are familiar with, in person of Dr. Kenneth Eguda. Dr. Ken, it's good to have you.
Thank you.
For the sake of someone watching for the first time, just a bit about Dr. Ken. He's a consultant gynecologist, he's a minimal access surgeon, a fertility specialist, one of the best IVF specialists you definitely would look forward to meeting or knowing or seeing or consulting with. He's also the one that pioneered laser gynecological surgery in Africa. So that's a lot. Just a bit. This is just a bit. I don't want to talk so much, but this is just a bit about Dr. Ken. So today we're talking about male fertility. As we get started, please call up someone, share this link with someone, as many people you could share it with. Please do that right away and feel free to drop your thoughts, your comments, your questions in the comment section. We'll definitely respond to them appropriately. So as we get started, please sit back and enjoy the show. So yes, we're talking about male fertility beyond sperm count. Well, that sounds like an interesting topic, you know. Maybe you tell us a bit about now that we are saying beyond sperm count, so it means there's more to male fertility. So maybe you give us a bit of what really comprises of male fertility when we're talking about male fertility.
I don't think I understand what you're saying now. Um,
Beyond sperm count. So I don't know if there are other parameters that you would want to talk about that comprises of male fertility just beyond their sperm count. Are there instances that you could see a sperm that seems okay and you're wondering what's happening? Why is this not happening? Or there are some other
mhm.
things that you're seeing not normal.
Yeah, it's clearer now.
Okay.
Yeah, I was just thinking initially that you know, quite a number of guys who actually think they have normal sperms and you find out have abnormal sperms, you know, will get to tell you later that someone is just pregnant.
Hmm.
Someone is pregnant. So can take a look at this woman very closely
Hmm.
because I think I'm doing okay. Yeah, and the women are actually have actually learned to be a little bit smarter. Okay, you made someone pregnant.
Hmm.
Let's see, let's see if it is you who made the
Exactly.
person
Hmm.
pregnant.
Yeah.
And they go do DNA analysis, paternity tests,
Yeah.
and only for you to find out that
You're
it's
not
not
the father of the
you're not
child.
the father of the
Bust their
baby.
bubble.
So I was thinking that was beyond sperm count.
Mm.
The things we see beyond sperm counts, you know. So this is a recurring decimal, amongst
Mm.
people in a relationship. Yes, and when you go to some part of Africa, for instance,
Yeah.
you have a man that has a subnormal sperm
Mm.
and goes all out blaming his wife for not getting pregnant,
Pregnant. Mm.
and then he adds another woman. So now he has two
Two
wives,
ways. Hmm.
and then the two wives goes infertile, not pregnant,
Pregnant.
and he
Mm.
still blames the two of them and goes to add a third
Why?
woman.
Hmm. Oh.
You know, you just begin to wonder what's really going on in the head of this man. You don't think males can be infertile?
Fertile, exactly.
Males can actually be infertile. In fact, male are more infertile these days than
Then
women.
women. Wow. Wow.
Exactly, male are more infertile than women, and so it's good to know that marrying an extra wife or claiming you made a woman pregnant outside
Mm.
while your wife is not pregnant or your official legal partner is not pregnant
Pregnant. Yeah.
is a sign of your fertility. What do I use? Which word do I use now? Your fertility power,
Mm.
that you are a super guy or something. It doesn't
Yeah.
really follow,
Yeah.
you know. In fact, the fact that the women that are even living with you in the same house are all pregnant and are
Pregnant.
just delivering, does it also mean you are okay as a
Like
man?
that's true.
We're living in a very tough period, tough
Like they
times,
say, only a woman knows who is the father of a child.
Thank God for forensics and DNA paternity tests.
Mm,
So yeah, so there's actually a lot about male fertility, and male fertility is towering high, and lifestyle is actually not very
very
helpful
helpful.
these days. So yes, fertility beyond sperm
Sperm
count is
count.
what you
Yeah.
said. Yeah. So
Yeah.
so let's look at what is normal about the sperm
Sperm.
actually.
Yeah.
And by the way, before that, I was in a gathering
Okay.
of women,
Okay.
and they were talking about their ordeals.
Hmm.
And some women actually are subjected to do fertility tests before getting into a legal relationship.
Nation. Wow.
And some of the women were like, okay, can't we also demand
That's
that the
all men.
men do sperm analysis before we
Okay.
get married to them?
Yeah.
And that actually
It makes
makes some
sense.
sense to me,
Yes. Yes,
because if
it
you're
does.
asking a woman to do this, why wouldn't you just do this
Exactly.
simple one?
Yeah.
Just one,
Exactly.
you know,
I'm
just
putting a
one.
woman through
Oh, yeah,
all she
instead
has to
of
go
putting her
through.
through all of
Mm.
that. So, yes, so men can do that while getting ready for fatherhood business.
True.
Yeah,
Yeah.
while the women are looking
Fatherhood.
for how to take care of themselves too.
Themselves. Yeah.
So, sperms that is normal actually should have a count of at least 15 million per
Mm.
meal. Then you have the criteria for the volume, then the criteria for the motility. You have active motility should be significant based on what is accepted as a range of normalcy in your period. I mean, 35% and above actively motile, it's
Motivated.
okay.
Okay.
Occasionally, you see subnormal sperm making women pregnant, real pregnancy, I
Wow.
mean, spontaneously.
Yeah. Yeah.
So, but the range that we're comfortable with for spontaneous pregnancy, I mean, it's about 15 million per
Million.
meal. Then you have the pH, the volume, and whether or not there are bacteria in the sperms are all considered, agglutination tests and all of that.
That.
So, but beyond what is accepted as normal,
Yeah.
there are things that actually affect the functionality of the
Sperm.
sperms. So now, one of those is a DNA of the
Oh.
sperms. Yeah, the
Okay.
DNA of the sperms. You know, you see occasionally men with normal sperms, and then you see their partners looking okay, the female partners looking
Yeah.
okay, and then getting pregnant.
Pregnant.
And then you do a DNA fragmentation, for instance, and you see that the DNA fragmentation is high, maybe somewhere beyond 45%. The DNA in the sperm, so just in the head of the sperm, that round thing that look like the head of a tadpole,
Hmm.
you know, it's where the DNAs are concentrated, and that's
Yeah.
what carry the hereditary materials. So now this DNA may be fragmented for several reasons.
Okay.
When a man is undergoing a lot of stress, too much work, no rest, exposure to hostile chemicals. And when you talk about chemicals, we're really talking about chemicals. It could be agro-allied chemicals, it could be industrial chemicals, like the chemicals you get exposed to in building sites, you know, even some chemicals that were applied in the name of makeups, or creams, or antiperspirants, and all of those. So they could constitute what we call the endocrine disruptor factors.
Oh, wow.
And some of these things could actually damage the potency, could affect the potency of sperms. And
Sperm.
one of the areas they could affect would be the DNA integrity of the sperms. And
Okay.
they could make the DNA fragmentation index to be high.
Hi.
You know, so those are some of the things. Then some disease conditions, of course. Diabetes, some medications you
Yes.
use
Wow.
for treatment of some conditions, even some antihypertensives,
Wow.
could affect the integrity of sperm and reduce the physiological capacity of the sperm for making a woman pregnant. So yeah, this is things that go beyond
Sperm
sperm
count.
count. So it's not all about the count of the sperms. It's about the function of the
Sperm.
sperms.
Wow.
Yeah.
So it's not just about having normal sperm count. Dr. Ken has made us to know that there's just a lot beyond the sperm count. And even if you're even getting a woman pregnant, if she's not able to, if she keeps having miscarriage, traceable to possibly if it's not associated with her
Yeah,
eggs,
yeah.
then that means they might have to also look inwards into
Yes,
the
from
sperm.
the histopathological findings of
Hmm.
product of conceptions.
Yeah.
What we're seeing currently is that some of these miscarriages are caused, I mean, a lot more of these miscarriages are
Yeah.
caused by abnormal sperms than abnormal
Abnormal
eggs.
eggs. Oh
So much
wow.
more that it is said that if a woman has miscarriage,
Hmm.
the man should be sorrowing and not the
The
woman.
woman. Oh
Yes, that's the
wow.
current status of sperms.
Hmm.
And because of exposures to hostile environments, the characters on the sperms are getting damaged. I'm talking about deletion, especially in the Y chromosomes.
Hmm.
They're getting deleted, so that a lot of childhood abnormalities or problems in later life
Yeah.
are caused because of abnormal sperms that have brought about a child. And things like
Hmm.
Alzheimer's disease, and some other disease conditions are because of the problem that had happened with the sperm.
Sperm.
So
Wow.
this is beyond sperm count.
Count. Yeah.
The rate of having autistic kids these days,
It's really high.
it's also high. And
Honestly,
this
it's on
is
the
a
increase.
malfunction to a large extent, malfunction of the sperm. There are other causes of or autism, you get. But then sperm, especially from aging men, is
Hmm.
also a big factor
Factor. Wow. Wow.
causing autism in babies.
Wow.
So these are things that goes beyond the count of sperm. So
Hmm.
these kind of guys may have 20 million count per meal, but then the products we get from the sperms
Hmm.
may just be subnormal.
Wow. So, viewers, this is a lot. Please, I would want to emphasize. Please call up a man. Call up all the men in your life right now. If you've not called up someone, or share this link with us, many men that you know, so they are able to draw from this information that is being passed across today. So there's just a lot with this sperm that we're getting to know. And I was just thinking that okay, now that we're having to deal with a lot of sperm issues, I'm just wondering what the possible is it because of their lifestyle? Because I know I would want to think that a lot of men drink more more than women. And then, well, even though yes, we might not be able to say, oh, this is what the statistics could be, but we know the lifestyle of maybe drinking, smoking is it seems to be more common with men than women.
I like to think of it differently. Don't just say men are drinking and smoking.
Well, now I'm
Well,
just
do you have
talking
a
of a
problem?
part of
Do
it.
you have a problem with that?
Well, I'm just talking about a part of it because yes, there are some extremists. So I'm just saying that's a part. But
Mm.
maybe this is just me saying something. But maybe you should tell us a bit more about possible lifestyles or possible
I
things
would
that
rather
people do.
think of stress.
Okay.
Yes, I would rather think of stress.
Okay.
I'm making reference to physical
Yeah.
stress. Okay,
Okay.
physical
Okay.
stress.
Mm.
There's no time in life that men are undergoing so much physical stress than they are
Then, wow.
going through right now. So I prefer to keep it a little bit simple before going to your
The part of
smokes and alcohol
that's just a bit of
consumption.
it.
So men go through a lot of physical stress. See men working 3 jobs to survive. Do you know how many jobs I work? Yes, even as a doctor, you know, juggling so many things, keeping so many jobs, and then you're working against tiredness. And when you work under these kind of conditions, for instance, your body generates oxidative stress and oxidative radicals. And these don't only damage the sperms and damage the DNA of the sperms, even your whole body gets damaged, when you go through all of this. So for
Stress.
me, this is something that is common to men.
Stress.
Yeah, this stress. Okay, sometimes you live in, depending on the part of the world you live, for
Yeah.
instance, here, okay, I've stayed in a couple of places. I remember living in India for a while, and then you're close from work, and the length of traffic you go through to get to your place of residence,
Yeah.
could be very massive. You see no end from the beginning.
Wow.
You're just patient till the day you get to
Yes,
wherever
too.
you're going to. That process of going through all this traffic, one, you are emotionally stressed, you're physically stressed, you are consuming carbon monoxide because they are not electric cars.
Yes, it's true.
And all these oxidants get into your body and cause your body reacts to them some ways. Plus the fact that you're tired, no adequate rest, no good sleep.
Wow.
So these are all stress, and the body respond or react to
Then,
stress in the same way. Your cells get aged. I mean, aging is faster when you are stressed and all of that. So even
yeah,
the elements in the body, the sperms and all of the cells,
yeah.
they wear out. And so I would rather talk about stress. And now this stress could be in any form. Too much work hours, could be the stress. Lack of peace could be a stress,
Stress.
you know. So this actually affects a whole lot of things that we do. Then, of course, some people work in hostile environment, radioactive environments, you know, and sometimes you don't even know that this environment is radioactive because there are no gadgets to check, and all of this affects the stress that the cells in the body go through, and they can affect not just the sperm but the entire health of the man. And of course, then now the substances you talked about, these recreational drugs, the cigarettes, the hems, the alcohol, the different grades of alcohol, and all of that. So all of these could actually affect the health of sperms too. So this is not to say those who drink or smoke don't make pregnant. They make
Okay.
more pregnancy than because at least they rest, they have deep sleep, and poor sleep also affects fertility. Yeah, poor sleep affects fertility for men and for women.
Wow.
Poor sleep, yeah, it affects fertility, and that is why currently the world is moving towards making infertile couple see reasons to sleep more,
Oh, okay.
consuming melatonin, so that they can have good sleep and relaxation.
Oh,
Because
so,
good things happen when you relax and when you have good sleep, including fertility.
oh, wow.
So all of these affect the quality of
Quality of
gametes that men have. I mean, in this case, the sperm, and then it could undermine the count, a good count, apparently. Because you see, when you go to the laboratory to do sperm analysis, the guys in the laboratory only interact with the sperm. They don't interact with the environment that the
Yes.
carrier of the sperm is coming from. They don't
True.
interact with the history
Yeah,
of the
that's true.
sperms. And so you just leave the laboratory, and the guys in the laboratory, oh, you have good sperms. And everybody is happy. The doctor say my sperms are good. Who said so? So you have to check the DFI, the DNA fragmentation.
Oh, okay.
Exactly.
Wow.
To
Wow.
see, and some other physiological functions. There are times we saw sperms and we're preparing sperms for IVF, for
Yeah.
instance, and we take them through the conventional process of preparation. And the
Yes.
sperms do not sediment. Good count, but refuse to sediment. Because you see, in IVF, for instance, the andrologists, do what they call gradient separation of sperms, or what they call sperm washing.
Okay.
So
Okay.
the sperms are passed through two different gradients, and they have to have a certain weight to go through this filtration gradient
Wow.
after being spun for the number of revolution per minute
Yeah.
in the centrifuge. And sometimes you come, you don't see no sediments, no pellets
Wow.
in the bottom of the tube, which means these sperms are not heavy enough to be separated. Already, this is a pointer that these sperms are not having the adequate weight of the DNA they should have. So there's a problem with the DNA.
Wow. Wow.
And then you now tell the men that your sperms are not good. How do you mean 20 million sperms not good?
Good.
What happened to
Exactly.
them? So you have to take them through some other means of
Yes.
preparation that doesn't screen them off because of weight. So you could just select some sperms, either using the electronic, the AI assists sperm selection,
Yeah.
or the swimming assist sperm selection. So you could just take a sperm. But when you're getting to that level of preparation, of selecting of sperm, you're already selecting most likely those that have failed to meet the appropriate criteria of traditional
Yes,
separation.
exactly.
So you are selecting the next good sperm.
True, true.
So these are things that are beyond
The
sperm
sperm count.
count.
So, viewers, it means don't get too comfortable when they tell you your sperm count is good and
Yeah.
then your wife is not achieving pregnancy. You don't keep pointing fingers. It means you need to do further checks, like Dr. Ken has mentioned, maybe DNA fragmentation to check that more structure of the sperm and all of that, just to know what's happening with it, and don't just keep pointing fingers at the woman that
Yeah, and so
everything.
sometimes we need to check the testicles, for
Oh,
instance,
okay.
because before now, um, the urologists may not have considered uh, varicose veins as
Okay.
being very important in evaluation of men with infertility.
Okay.
You know, so but for those of us who are reproductive gynecologists, for instance,
Yeah.
and urologists who have spent time in the field of reproduction, knows that varicose veins could be a big issue. You could have a lot of sperms, but when you have a lot, I mean, significant varicose veins, the metabolism around the area of the sperms are affected because there is too much heat around the sperms. The metabolites around the sperm are not drained off, around. So the sperms are exposed to a lot of oxidative stress.
Wow.
Yes, and so they may be dysfunctional. And what is expected if fertility is an issue for this kind of individual
People.
is to get those abnormal veins, these dilated tortuous veins to be excised and removed so that the sperms can grow in healthy environments.
Environment.
Because the
Okay.
way nature designs a man is for the testes and the bag of the scrotum should be like 5 degrees centigrade or Celsius lesser than the general body. So if the body is
Okay.
37, for instance, the
Yeah.
scrotal area should be like 32. So when you have varicose veins, that dynamics change.
Changes.
Yes,
Okay.
you could have healthy sperms, no doubt. But when fertility becomes an issue,
Challenge.
this needs to be looked into so that the condition can be optimized.
Wow.
Yeah.
So there's just a lot. So it's not just to go and sit and relax when they tell you this is fine and then
Oh no,
pregnancy is not happening. It has gone beyond just the sperm count now.
exactly. For those who do IVF, for instance, the andrologists and gynecologists doing IVF, they will
Yeah.
understand all we're talking about. So the laymen are only comfortable when the sperms are, let's say, in 15 million per mils and above. But for us, it is not so because that's just a count.
So
There's
that
so much more to sperms.
So that can explain why sometimes you've told the woman that okay, donor egg is the best, and then now they're opting for donor egg, and then sperm is still not giving us good quality
Exactly.
embryos, and you're like,
Yeah.
but the sperm looks okay. So it means it's a call for more investigation. So wherever you're watching from, just in case you might be in this category, it means you need to do some form of more. Maybe you need to see a more experienced gynecologist or fertility specialist like those we have at ALP, so more analysis could be done and more investigations could be done and possibly prefer solutions to whatever it is that you might be dealing with. So now, yes, so if for as we wrap up, what would be if someone is to take or if a man is to take some steps to preserve their fertility, what are the steps that you think you would want to cancel? Maybe once a step or two or three steps.
I wouldn't finish my discussion, my thought about sperms without also mentioning men with traditional low sperm counts. Those ones already compromised, even to the number. Then there are
Yeah.
men who have a blocked vas deferens, and so they can't ejaculate to the exterior sperms. Okay, and for those kind of men, you need to do a testicular surgery. I mean, a procedure down the testicles so you could extract sperms.
Sperm. Oh,
Then, when you get to the level of extracting sperms or aspirating sperms from the testicle, you also may not be dealing with the best of sperms.
sperm.
They can achieve pregnancy, but the rate of success coming with those sperms may be lesser than when you have capacity to ejaculate those sperms. Because when you aspirate or do a testicular extraction, you may be getting sperms at different level of maturation. And so if it's an immature sperm, what do you expect?
Mm.
Chances of succeeding
No.
may be low.
Mm.
And
Sure.
then if you are getting a sperm that has been blocked from being ejaculated, it may have been there for a very long
Long
time
time.
with
Mm.
aging on the sperms because the sperm have life
That's true.
cycle, aging on the sperm and exposure to a lot of oxidative stress and product of metabolisms
Mm.
that have not been drained of, and
Yeah.
so
Mm.
the sperms may also be compromised. But in any case, that's
Yes.
what you have, and then you have to use
Exactly.
it. And
Mm.
so you may not get the best out of all of this than I mean, but because that's just what you have, you
Mm.
just have to make do with
With
it.
it.
Yeah,
Exactly.
except of course if they want to consider some other options. And that is why you see that success with testicular extracted sperms is lesser
Mm.
than with normally
Ejaculated
ejaculated
sperm.
sperms.
Mm.
Yeah, those are the things that
Makes a
happen.
lot of
Yeah, yeah,
sense.
yeah.
Mm.
Those are the things that
So
happen.
for those that fall into the category of whether having a normal sperm, struggling with fertility, or you've been told you have low sperm count, there's just a lot for you to deal with. There's just a lot of investigations to be done, a lot of interventions that are available, which you could actually assess at ALPS hospitals. Well, let's talk a bit about possible steps that they could take to preserve their fertility. As the man, what they
Hmm.
can do to preserve their fertility, or for those people that feel, maybe for the younger ones that feel their sperm is okay now, they should enjoy life, and then later childbearing becomes a problem in the future. What should they do?
Okay, let's start by those who are into sports.
Mm.
Avoid trauma to the
Oh,
testicles.
okay.
Sometimes I
Hmm.
watch UFC. I'm
Hmm.
an ardent. I mean, I'm a follower of the Ultimate Fighting Championship
Mm.
or the EFC Extreme Fighting Championship, and
Yes.
sometimes you just get some strange blows to the
Hmm.
testicles, and
Hmm.
then the guys are down.
Hmm.
So avoidance of all of those
Trauma
blows, unnecessary traumas to those areas can
areas.
actually help because if you give a blow, I mean, you deal a blow to the testicles, for instance, you may be damaging quite a number of things because you could have micro traumas
Hmm.
on those cells
Yeah.
that help in the growth and development of sperms, and these traumas will heal with inflammations.
Hmm.
And as they heal with inflammation, they'll be affecting the process of sperm growth and development.
It's true.
And so it could
Hmm.
affect the health of sperms, and then it could cause infertility later. So sports guys generally should be careful about that, and they should do their best to protect, damage to
To
and
the
trauma to the
to
testicles. Then,
okay.
of course, those in sports also do have the habit of social or recreational drug consumption.
Hmm.
Yeah, especially those who are into the power exercises, so that can be minimized. They should minimize that because it could also affect sperm development,
Hmm.
especially the steroid groups of drugs, and then those who do recreational medications or recreational drugs could avoid that, and because it could also affect the health of sperms.
Hmm.
And when the health of sperms are affected, the health of babies are also affected.
Affected. It's true.
So the quality of babies you have could be affected
It's true.
when there are some deletions
Hmm.
or some micro deletions on
Hmm.
sperms.
Yeah.
Some
It's
of
true.
those may just have some bearing on the quality of life. So these are some things that I think men can do, and they should minimize excess consumption of alcohol and cigarettes.
Substances.
And
Okay.
then when they are in the fertility age and they are planning fertility, they should take time to have good sleep, good rest, eat healthy,
Hmm.
and sleep well. That
Oh,
could be helpful. Then, of course, for those who already have compromised sperms, they
fertility.
should go ahead to freeze the sperms because
Hmm.
sperm that are already compromised have chances of getting
No
worse
worries.
by
Okay.
the year,
Hmm.
and then you may not have them when you need them
Need
anymore.
more.
So they should meet the fertility group, fertility clinics, and think about the options of cryopreserving the sperms. I mean, freezing the sperms.
So when you're talking, I just thought of those parents that their male children have undescended testes. And they're praying to God, oh God, drop the testes.
Sometimes I go to bath. Sometimes I go to bath my son.
Mm. Yeah.
I just do that because a lot of weird stuff go through our heads. Depending on this. If you're a psychiatrist, for instance, you see that you look at the street or you look at
I know.
everybody, you see
Yeah.
that they're all mad.
You think in that line.
You think in that line. So for those
Yeah.
of us who are in fertility, for instance,
You also.
we're also thinking that line.
Yeah.
I've been examining guys' testicles. Let me go see what's happening to my
We.
son. So I take him to the bathroom. Hey, Jeff.
Mm.
Sorry, I mentioned his name. I'm going to give you a bath today. Say why? I said, don't worry. Daddy and son
Once in a while.
things. So I take time to palpate. I take time to palpate the
Yeah,
testicles.
to be
And
sure
that
that
and
they
that
are safe.
tickles and that tickles him. I said, Daddy, what are you doing? I said, come on, keep quiet, my friend. Let's do this thing quick and get out of the bathroom. So yeah,
Mm,
there was a video I watched on
yeah.
TikTok. A
Mm,
little boy, I mean, a Caucasian, I guess.
yeah.
He probably went to pee and he felt
Okay.
there were nothing in his testicles. And he
Mm,
came asking his dad. I don't know whether he was acting, but it looked real.
mm,
He said, Dad, I can't feel them. The dad
mm.
said, What? I can't feel them. He said, What? He said, the balls, I can't feel them. He said, What do you mean the balls? He said,
Oh.
Can't you remember that round thingy? That round
Oh my
thingy.
goodness.
And you could see literally this little boy was crying.
Mm.
So I got the video quickly and sent it to my urologist friend. I said, See your patient. He couldn't find his testicles.
Oh my goodness.
Well, for a child, you could have what we call the cremasteric reflex
Okay. Mm.
when the testicle recede into
Mm.
the groin, I mean,
Okay.
lower part of the abdomen. Okay.
Okay.
So the bag of scrotum becomes empty.
MC.
So the
Okay.
boy may be going through that stage, but of course, it will have been reassuring for the father to call him and examine it if he knew what it
Yes.
was all about. Because it may just be
Exactly.
a pointer
That's
to
true.
something. But how
Yes.
did the
True.
boy know that he needs to feel his testicles down there? Is
Exactly.
what I don't even know. Just because
Maybe he's just used to there's a change or something.
exactly.
Something.
So at birth, actually, the doctor or the nurses who conduct delivery are expected to check the testicles to be sure that the scrotum, to be sure that the testicles are down there.
Mm.
Because if it is not there, you need to look for it.
Mm.
Yeah, sometimes maybe they may be undescended, and that means the child is already automatically born with not just infertility,
Mm.
but a risk of cancer
Mm.
later in the future because
Wow.
it will be heated up
Mm.
by the warmth of the body and it will be atrophic, then it will die off, then it could change form,
Mm.
metamorphose to some other things.
Thing.
So you need to find it and bring it down
Down.
and anchor it.
It's supposed to be. It's really
Lord
uncle.
Jesus. You anchor it
Yes.
like with a guy rope,
Oh, yeah.
so it stays where it is.
Mm.
So these are things that parents should do for their kids
Mm.
because the kids today are going to be the parents
Parents, that's
tomorrow.
true. That's true.
So they need to check all of that. Yeah, because today we see adults, even in the clinic, at
Yeah.
30, 35,
Hmm.
with undescended
Testes.
testes.
Oh no.
This is not long. This is no longer undescended testes. It's neglected
Yes,
undescended
exactly.
testes.
Mm.
And if you have an undescended testes for a long time, it also affects the descended one.
Oh gosh.
You understand? So you could be when you have an undescended testes.
Testes. So
So
parents, even
parents
when
should check.
yes,
More
and
so,
then
men are under attack physically and genetically. Yeah,
okay.
seriously, men are
Wow.
just the race of men is under attack. So we have
Mm.
to do everything
Yeah,
to protect the men
that's true. We
and
have
the
to do.
sons.
Can you hear that? Do everything to protect the viewers. Viewers. So for those parents that fall into the career,
Mm.
maybe they've even told you your son has undescended testes. Or yeah, do
It's
not be
called
scared of
testicles
testicles. Thank you.
or testes.
Dr. Ken. Whatever it is your doctor calls it for you. Once they say it's undescended, please do not be scared of going for surgery to get it descended. Like Dr. Ken said, to get it anchored to where it's supposed to be. Do not be scared and don't allow that child to just keep growing with it
Mhm.
and then Later on, you are praying for grandchildren. Grandchildren are not forthcoming because you refuse to address the situation when the child was a baby or the child was still a child. I mean, so please let's do the needful and let's
Mhm.
take every bit of all that Dr. Ken
Mhm.
has mentioned today because they are really big issues and it's coming from the point of knowledge of experience over the years, and these are things that he has seen countlessly. So we can't afford to ignore any of these details that we've actually gotten from here today. I know that you guys had a good time with us today. Dr. Ken, any final words or I can wrap up?
Even the younger kids that are going to undergo some form of chemotherapy, for instance,
Yeah.
and they have a good chance of cure,
Mm,
it's good for the oncologists now. The medical experts
yeah.
should take responsibility because parents may not be thinking about this at that point in
Yes,
time,
that's true.
so they don't come challenging you for not
Yes.
informing them that the chemotherapy, radiotherapy, or whatever therapy you're going to get for cancer or some related blood diseases would
Yes.
destroy their fertility.
Hmm.
So if they are of age and they can produce sperms, it's good to get some of these cells or gametes and save it,
Hmm.
for future. Because once you go through chemotherapy or radiotherapy, sometimes chances are high it's going to be the same goes for women.
Hmm.
So I think we medical experts should educate the people and let them know because that time comes when you just care about your fertility. Yeah,
That's
yeah, I think we should do.
Thank you so
Yeah.
much, Dr.
Mhm.
Ken, for that information. Because it's been good to have you guys stay with us. It's been good to have you guys engage us. I know you had a good time. Because yes, even me as a host, I had a good time with my session today. So I know you had a better time than even I did. Okay, yeah.
And by the way, before you finally close,
Okay.
sometimes we check sperms and average a day I may check like 25
Hmm. Wow.
sperms from 25 men,
Hmm. Wow.
averagely, sometimes more than that. And we had seen normal sperms. When we see normal sperms, yes, in this part of the world, and I think it's, you see people from different demographics. So, and I'm just wondering, okay, we talked about the embryologists and the doctors. I
Yeah.
said, come, guys, we just all need to go check our sperms.
Oh, yeah.
Seriously, yeah, you need to go check the sperms
Hmm.
so you don't just
Assume.
assume you're okay,
Hmm.
and then the demand is made of you. You
You
find out you are not
realize.
okay.
Yeah.
Can be preserved and
Hmm.
used later,
Exactly. Yeah.
as against just assuming because you think you're superhuman as a medical practitioner.
And all of
No,
that.
we should all check. Also, when you know that you're going to need to make good use of your sperms
Exactly.
later, or you can freeze them. You don't use them, some other persons may use them.
Oh yeah, freeze and thank us later. Because you never can tell whether you who you're
Oh,
saving.
sure, that's true.
Thank you so much once
Mhm,
again,
mhm.
viewers. I hope you have a
Now you
lovely.
can close.
So it's closing time. Oh yes. Once again, I know you had a better time than I did. Please do well to share this link with as many people as you can so they could even watch the one that you've already missed. Whatever it is, even if you're not able to join from the beginning, there's just a lot from the beginning to the end that nobody should miss. So you could even still rewatch this, post to someone else to still watch and get as much information as they could. You could all our handles, you could access all of our videos and all handles. And yes, we would look forward to seeing more of you in our next session. But until then, have a lovely evening.